Hi, I'm Dr. Nicole Vane, the owner at Moonlight Beach Dental, general and holistic dental practice here in Encinitas. And I wanted to talk today about Invisalign. It's a product I've been using for 14 of my 15 years of practice. I absolutely love it. I'm actually in treatment now. I can show you what my aligners look like with them in a little bit. But one of the things I wanted to talk about is why would you go to an orthodontist versus a general dentist for an Invisalign case? So general dentists are allowed to treat Invisalign cases, and actually we're allowed to do any type of orthodontic movement. Orthodontists specialize in treating all of the more difficult cases, and especially cases with brackets and ligature wires. Invisalign with digital dentistry gives us both the freedom to treat the cases in the same way as you would with traditional braces, but without the hassle of having all of the hardware that's associated with it. So I've become a very active provider. I do several cases a day, usually, of new starts. I've done hundreds of cases, and it's just an amazing product. One of the advantages of having a general dentist who's skilled in it do your case is that one of the most frequent reasons I do Invisalign, including for my own case, are not just for the cosmetic benefit of having the teeth straighter, but most often it's to correct someone's bite so that they can have more restorative work done. I myself have 2 veneers that were done about 14 years ago. I'm not unhappy with the way they look, but I do think that I could treat them a little bit better as long as I move my teeth to a new bite that'll not only be more comfortable for me, but that will be more aesthetic for me having my 2 veneers replaced. So I'm doing the Invisalign first. Most often, this is my case that's up on the screen, most often we like to use our digital scan and our digital models. We can really study someone's bite, and most often people are breaking teeth due to what's called a collapsed bite or a traumatic bite. So simply, the teeth are not protecting each other in the ways that they should because of their alignment. So teeth are meant to glide off of the ramps of the cusp tips and the glide path of the cusps of single-rooted teeth like canines. So when your teeth are banging into each other too much, you'll start breaking off enamel, and your bite, over time, the teeth will keep erupting down to meet one another until they absolutely meet and there's no room for restorations. Or in some cases, it'll look like the teeth are very unaesthetically positioned, too low in someone's face, or it'll look like they have no teeth at all when they're speaking. So in some of these cases, such as this one, this patient's main concern was that he was breaking his front teeth and also that he's wearing down all of his lower front teeth and that he's now missing one. So on these upper teeth, when I look at the bite, you can actually see that there's no room for me to restore the edges of these teeth. And if I lengthen them back to the way that they used to be years ago before all of the wear occurred, they would then look, based on their current position, extremely horsey and unaesthetic. But also, the lower teeth would break them off immediately because there's no room for me to put any restorative material in because his lower teeth now rest in the holes of where the upper teeth were broken. So as a general dentist, when I know that outcome in mind, in his case he's going to need a couple veneers, I can actually move the teeth out of the way so that I have to do very little drilling or trauma to the teeth. The other thing is, as much as I love cosmetic dentistry, and I really do love it, and I love smile design, to me there's nothing better than having your own natural tooth structure there. So if someone had a gap in their front teeth and they had really nicely shaped teeth, you could go to one dentist who says, I'm going to do 6 veneers on you and grind away some of your enamel. Or you could go to another dentist that says, hey, you know what? I actually think that we can close those gaps and do either a little bonding or do nothing and just close the gaps with Invisalign and get your bite correct. So I really find that very useful as a general dentist that I can do both. Now, if it's an extremely difficult or skeletal case where I think some extra hardware might need to be involved, I have several orthodontists that I love to work with that I would happily refer you to if you ever had a need or a more specific type of case. But what I use it the most often for, besides just simple lower crowding on people who didn't wear their retainers, are in cases like these where someone comes in for a cosmetic consult, or they simply come in and say, I broke my front tooth and I want you to fix it, or I broke a back tooth and I want you to fix it. And I'm able to show them digitally that I simply cannot do that. I have a 70-year-old patient and a 65-year-old patient that said that they kept breaking the bonding that was on their front teeth, and their general dentist just simply never told them that anything could be changed about their bite so that that didn't keep happening. So in this patient, her front tooth was chipped and worn because her lower tooth, if you look here, is pounding on her front tooth. So not only has it pushed it up in position, it's also worn the edge. And as the tooth has continued to drift down, you can see the difference in the gum height and the difference in the length of the teeth. So her previous dentist and her chief complaint to me was, fix the edge of my tooth. My bonding broke again. When you show someone though that they have this much crowding on the bottom and that we have to actually make space by moving these teeth out on the sides so that I can move these teeth back in, and then you can make space here and broaden these so that in the end result, where this tooth was hitting, I now have space. If you look at this space, it's very valuable to see that now, not only do we pull this tooth closer into position, but I can add the bonding back to that edge and give her the smile that she wants with very conservative dentistry. So I hope this answers your question and helps you make better decisions about why you would choose one dentist over another, over an orthodontist for doing your Invisalign treatment. And being in treatment myself, I certainly can talk you through the process from a personal as well as a professional aspect. So feel free to pop in anytime or ask me at any of your cleaning visits what you might like to do or change about your smile. And also feel free to ask any questions about how I could use Invisalign to help you with your case or the case of a family member. I hope you found this video informative.